There's an amendment at the desk. The clerk will report the amendment.
New Brindley moves to amend Senate File number 5335, the unofficial engrossment as amended. The amendment is coded A3.
I recognize the author of the amendment, Representative New Brindley.
Thank you, Madam Speaker. This amendment should be a little bit easier because this one is not talking about any additional funding. We're not pulling money from any place and putting it anyplace else. So there should be no reason to not take this amendment. So this one takes the loan program for financially distressed nursing homes. It removes the changes on opening this up to everyone, but it maintains the revolving loan program with no expiration date. So what we know right now is that of the $100 million that was already appropriated, 54 facilities applied for a loan because they are financially distressed. And again, being financially distressed means that we have 54 nursing homes that believe that they meet the requirements of not generating sufficient revenue to cover their operating expenses. We have 54 nursing homes at risk of closure right now. We have 54 nursing homes that need additional operating revenue in order to keep their doors open, to maintain access to the care they provide. 54 nursing homes today, folks. This is significant. That is a massive number. Where did I write that down? We've already gone from 381 nursing homes down to 358 nursing homes. And we currently have an additional 54 nursing homes that have applied for assistance through this distressed nursing home loan program to the tune of $90 million. Now, what's scary is that this does not include nursing homes who are already so over-leveraged that they cannot take out another loan. They can't do it. The loan program is already maxed out. And we cannot expand this bill to cover more providers under this loan program. It is already maxed out with 54 nursing home facilities telling us that they are at risk of closing. Their bills are more expensive than the money they take in. Madam Speaker, I'd like to request a roll call on this.
Seeing 15 hands, there will be roll call.
Thank you, Madam Speaker. I understand the conundrum that you have created for yourselves. I understand that you have created a problem and that you are taking money away from assisted living facilities, and therefore you are trying to give them a little lifeline through allowing them to take out a loan? But anyone who thinks that's a good idea, that that's a good way to budget, has lost their ever-loving minds. Instead of keeping you solvent, we're going to let you take out a loan. That's what we're doing in the underlying bill, and it's madness. It is so absurd. So let's at least protect the resources, these meager resources, that we have allotted for our nursing homes that are financially distressed. Let's protect these funds. And this problem is not going away, folks. 54 nursing homes today have applied for these funds. The problem's not going away. There are going to be additional facilities in financial distress. It's not going away because you have not solved the problem. In fact, as Representative Zalesnikar just pointed out, they have a fiscal cliff coming. Our nursing homes are going to be in a far worse position in very short order. The problem is not getting better, it is getting worse. So the least we can do is maintain the integrity of this loan program and ensure that it exists for these nursing homes that are going to need it. Please vote yes on the amendment.
Discussion. The member from Hennepin, Representative Knorr.
Thank you, Madam Speaker. You know, I'm trying to get this right. We either don't want this program to continue, because the problem that we're trying to solve is we're creating a revolving loan that does not expire. That's exactly what we're doing here. In fact, we're adding additional money for the nursing home and the long-term care. As you've heard, the nursing homes have already made the application. As soon as this program comes to closure, there'll be no funds. Zero. Zilch. No continuation. We've had this problem that is ongoing. If we are going to solve the problem, it's either we're supporting all the other long-term care institutions which are supporting our seniors and people with disabilities, or we don't care about them. We're not just taking out the money, we're extending it. We're creating an opportunity for others who are doing the same work that we're talking about right now. So if the belief is we should exclude the nursing homes, as the program is written right now, we can do that and just give the rest of the funding to other long-term care facilities in a revolving loan program. We can't be choosing who wins and who loses. That's why I'm being inclusive and saying if we're going to create a revolving loan, as we have had, the problem is not going away. If the problem is not going away, let's open this program up for the nursing homes, other long-term care facilities, the facilities that have already requested almost $90 million that in that account, the application has been received already. And if on the other side is the belief that we should keep the program as is, quite frankly, we can do that in the conference. Exclude completely the nursing homes once their time has expired and transfer those resources to the long-term care. I haven't had a single person say that. None. But we're willing to exclude assisted living facilities. We're willing to exclude the ICFDDs, people with disabilities, individuals who could utilize this program to support them. Members, we can't be choosing between a single nursing home program than assisted living and other institutions that need the same help. Vote no on this amendment.
The member from Kenny Yohai, Representative Baker.
Thank you, Madam Chair. And again, I want to appreciate Representative Brindley for bringing the A3 together for us here. Again, I've had a chance to visit with the chair about this as well. To expand the program of the loan program, which really none of us thought was a good move to begin with, but it was all we had, and it's all sucked up. It's gone pretty much because 7% of it went to the administration to deal with that. And my next amendment, we'll talk a little bit more about this as well. But I've always been concerned about anything that we do right now to expand any program to just keep us in the lanes of what we have to do now, because I'm not getting requests from assisted livings and others like I was the nursing homes. They are really under trouble. They are really suffering. And for any additional dollars to go anywhere, we had some really good ideas on the floor here today from Representative Zalesnikar and others that we could extend those rates a little bit. We could do more things with that. I don't know that I really am excited about a revolving loan because we're not actually fixing anything. Revolving means it's going to go on forever and ever and ever. I just think we can do better here, members, and let's figure this out about how to make sure that we stay and focused on our nursing homes to get it right, to get their rates extended, to find ways of taking as much as we can here today, Chair Knorr, to the conference committee, and continue to work on these kind of things. So again, thank you, Representative New Brindley, for this. I think we can do better with this, but let's not take that additional money outside of nursing homes at this point. Thank you.
Further discussion. To the author of the amendment, Representative New Brindley.
Thank you, Madam Speaker. That was a really weird conversation, actually. That was a really weird conversation. Fortunately, the A3 amendment actually maintains the extension of the loan program. Now, I actually was talking to my researcher, and we noticed that there's some terms that would need to be fixed in conference, just some titles to clean it up. But the A3 amendment maintains the extension of the loan program. And Representative Baker, I don't disagree with you. I would rather actually fix a problem. But that's not on the table, unfortunately. I would rather fix a problem. And this weird language that, well, I guess we can choose to completely exclude our nursing homes and just take care of everyone else. Why in the world would anyone even suggest that? Because that's not what my amendment does. And you want to say that we can't choose who wins and who loses? Well, that's exactly what you're doing. That is exactly what you're doing with this underlying bill. You have decided to get rid of the disproportionate share and hurt our assisted living facilities. That is what you have decided to do with this underlying bill. So you are picking winners and losers. Right off the bat, you're getting rid of disproportionate share. As Representative Baker said, and I had completely forgotten about that, but my goodness, 7% to the administration. 7% of $100 million. $7 million to review 54 applications. $7 million. That's what Democrats allotted to the department to manage 54 applications. $7 million. There's so much just obfuscation of the facts here. The facts are that we are getting rid of, and by we, the Democrats, are getting rid of disproportionate share, which is going to drive people from assisted living into nursing homes. While at the same time, we currently have 54 nursing homes who meet the criteria of being financially distressed. 54 nursing homes are at risk of closing today. At least 54. That's only those who could actually apply for a loan. That does not include those that may already be over-leveraged and unable to take on more debt. Because that's a real thing, that they can't take on more debt. 54 nursing homes. So you want to talk about picking winners and losers? I'll tell you who the losers are. Our senior citizens. Those are the losers that you have picked. You have chosen that our senior citizens are the ones who are going to lose with this bill. You're going to take away the disproportionate share, drive them into nursing homes because that's their only option, and then you're also going to take away the loan option for them. Because guess what? When you expand it to everyone, who's going to get the loan? Who's going to get access to those funds? It's going to be watered down to almost nothing. It's going to be watered down to almost nothing. So don't talk to me about picking winners and losers. That's not what we're doing here. That's not what Republicans are doing with the A3 amendment. We're trying to ensure solvency for the resources that currently take care of our senior citizens. We are trying to get a win for our senior citizens, for our moms and dads, for our grandmas and grandpas, for those folks being cared for at the highest level of care because they cannot be cared for anywhere else. That's who we would like to see win in this bill. That's who we would like to see win with this bill. So you can obfuscate and you can talk about how, well, we're going to exclude nursing homes completely. Great. Let's clean up the language in conference. We'll make sure that everything, all the I's are dotted, all the T's are crossed, to make sure that we maintain this loan program for our financially distressed nursing homes. That's what conference committee is for. That's an easy technical fix to make sure the T's are crossed and the I's are dotted, to make sure that we maintain this as an ongoing loan program for those nursing homes who surely are going to need it in the not too distant future, because we are creating additional financial crises for them as we speak. Let's maintain the loan program. Let's ensure the integrity of the program so that it is actually benefiting those facilities that are so financially distressed that they are in threat of closure. And let's get over this nonsense of, well, this is just going to give it to everybody else. We're not even helping our nursing homes. Well, great. Clean it up in conference. Let's do that. Let's take the language, let's clean it up in conference. Because if that's your intention, that's really easy to do. Madam Speaker, did I request a roll call on this?
A roll call is requested.
Thank heavens. Because I sure want to be on the record of supporting our seniors and making sure that the facilities they have to care for their needs day in and day out have this resource to maintain solvency.
Further discussion, the member from Hennepin, Representative Knorr.
Thank you, Madam Speaker. I just wanted to remind the body, if you adopt this amendment, and if it's the intention, you are essentially ending the revolving loan. So the loan program is completely cut off. I'll give you the line number. 1.2, delete section 6. I can promise Lead New Brindley that I will put that language in, if that is the intention, in the conference, that will exclude completely the nursing homes. If that is the desire of the other side, I'm more than happy to do that. Because that is exactly what you're voting for right now. So members, please vote no.
To the author of the amendment, Representative New Brindley.
Thank you, Madam Speaker. This is perhaps a really important clarification. I don't know if, and I get it, we're all at a different level in this chamber, but let's be clear, when we delete a section via an amendment, what that does, it does not delete existing law. That doesn't happen. We don't delete existing law. We delete changes that we're making to existing law. And so section 6 very clearly changes from a financially distressed nursing facility program to a long-term services and supports program. Gets rid of the financially distressed program and creates the long-term services and supports. The current language is that the commissioner initiate the application process for the loan described in this section at least once annually. statute already says that this is to be done every year, at least once annually. Now, there's language added that says if money is available, but this is already done every year. That's the existing statute. And then it talks about eligibility. And again, we change eligibility to be from a nursing facility to all of these other providers. We also changed the allowable uses of the money. So by deleting Section 6, we do not delete the fact that these applications are supposed to happen annually every single year. We don't delete that. And again, we maintain the language in the A3 amendment to make sure that these funds carry forward. We maintain that language. So I'm glad to hear that we are happy to work on this in conference. That should make it really easy for everyone to vote yes on this right now. That should make it very easy for everyone to vote yes on this right now. I'm so glad to hear that we are happy to do this and get this done. Let's vote yes.
Seeing no further discussion, the clerk will take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, no.
Carroll, no. Cagle.
Cagle, no.
Cagle, no.
The clerk will close the roll. There being 60 ayes and 69 noes, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Baker moves to amend Senate File Number 5335, the unofficial engrossment as amended. The amendment is coded A7-1.
I recognize the author of the amendment, Representative Baker.
Thank you, Madam Speaker and members. I wanted to also address an issue that I have a lot of concern about, and that is, again, our nursing homes that have applied for the loan program and are under distress that we've been talking about. There's 54 of them currently. There's more likely, but they just couldn't get themselves to apply for this loan. And what my amendment does, members, A7-1, is it allows those nursing homes that are clearly distressed to be exempted from fully into the Nursing Home Workforce Standards Board rules. These nursing homes are barely hanging on right now as it is. What we need to do is give them some time, a breath, to give them the chance to keep this thing going. You know, the board last year was put together. DFL wanted to have more mandates, more things to do. I think it's your favorite word is mandates. But for some reason, they wanted to get in this area, the Nursing Home Workforce Standards Board, which those providers didn't ask for. They didn't say we needed to have something like this, and it's causing them a great deal of stress. But the board was, again, a major concern for these providers. It's 9 members, if I can remember to remind everybody what this is. It's a 9-member board. 3 are appointed by the governor. 3 are from the agencies. That's 6 now. And then 3 are providers. So you've got folks that are almost losing before this thing even starts and gets out of the ground. So this is a problem just with really getting to the roots of why this was actually created. The board is designed to implement more mandates and regulations, and these providers at a time when they had to actually ask for a loan. Yes, it's an interest-free loan. Yes, they have got a little time to pay it back, but they're taking on more debt, members. And the rollout hasn't gone that well. Just recently, the board voted to approve unfunded wage increases for nursing homes at their most recent meeting. Now, this is coming, folks, without any new dollars from us, unless we're finding it somewhere that I don't know where this is. But this board is requiring them to increase wages. But the way to stabilize the nursing homes, folks, and increase worker wages, they feel is through wage increases. And we have to do that here. We can do that. We got to be able to find the dollars, the way to make this a permanent solution. But certainly giving those nursing homes that have asked for help temporarily with a loan, more debt, we should give them a break to not have to be included into the Nursing Home Standards Board at this time. Let's give them some time. This amendment allows them to, once they get the loan paid back, they'll have a year then to kind of be incorporated into this new Standards Board. But that's my amendment. It's simple. It doesn't cost any money, but it gives those folks the leadership, like we've heard from Representative Zalesnikar, that has been in the business for so many decades, so many years. She knows that we take care of these people, and this is just going to create way more standards, way more problems, way more mandates in an industry that we know how valuable our members are and our employees. Again, once a nursing home has repaid the loan and forgiven, and if they've had that loan forgiven, they can get onto the standards board like everybody else. But these folks are in big trouble. I'm hoping that we can take this amendment to allow them to hit pause on the new standards board, let them get the loan paid for, let them get out of the stress mode. Let's move on with some reasonableness to our folks. And Madam Speaker, I would like a roll call if I could, please.
Seeing 50 hands, there will be roll call. Representative Baker.
Thank you, Madam Speaker. Please vote green.
Discussion. I recognize the member from Hennepin, Representative Agbaje.
Thank you, Madam Speaker. Members, I would ask for a no vote on this amendment. The amendment as written seeks to undermine the Nursing Home Workforce Standards Board. The purpose of that law and the creation of the board was for the whole industry to work as a collective with labor, with regulators, and with the industry to determine the standards that should follow. The board is currently working as intended, as Representative Baker mentioned. They have met recently. They have updated wages, and that all falls within the current system that we created that allows them to do that under the VBR rate that nursing homes had already decided on a while ago. So exempting individual homes because of their need for a loan really doesn't actually support that home or the workers in that home. And then that's also true because the board also anticipated waivers for individual homes based on their ability to actually meet those standards. Basing it on an ability to, of their finances, of a distress, may not necessarily actually reflect their ability to meet the standards of the Nursing Home Workforce Board. So I would just again recommend that members vote no on this amendment. The board is working as it is intended, and both workers, industry, and regulators are all at the table. Thank you.
I recognize the member from Traverse, Representative Backer.
Yeah, Madam Speaker. Representative Baker, again, another good amendment. If we look at it, we are talking about distress nursing homes. It does not, it's really simple to figure out what the word distress is. We have to give them 911 help here, okay? This just is, it allows nursing homes some flexibility because the state of Minnesota, not a surprise, doesn't provide much flexibility to our nursing homes, but sure dictates everything that they have to do. That's including if they drop the paper clip, it seems like they got to pick it up a certain way. These homes are distressed because of the bureaucracy set forth by the federal government and the state. Let's just give them a little lifeline. This makes good. Thank you. Makes good sense. Thank you, Representative Baker. Vote green.
Further discussion. The member from Chisago, Representative New Brinley.
Thank you, Madam Speaker, and thank you, Representative Baker. This is just another example of trying to figure out some way that we can help save our nursing homes. I don't know, we've had how many amendments today? To try to tweak it, to try to do this in just a little bit different way? We keep trying. We keep trying. But we were just told once again, well, nope, this won't work either. This won't work either. I want to be very clear. I think it's interesting that Representative Baker's amendment is very specific. This is a nursing facility that receives a loan. That means these facilities have gone through the application process, and they have been found to, it's not that the facilities there believe they're in financial distress, it's that the department has decided, yes, they are in financial distress. These are facilities that are spending more money than they're taking in. That is a requirement of the program. These are facilities that are at risk of closure right now. That is a requirement of the program. These are facilities that need these funds in order to continue access to care. That is a requirement of the program. Those are the three requirements. All three of those requirements must be met in order for these facilities to receive the loan. How in the world do you think that these facilities are in a position to implement the new standards from the Nursing Home Workforce Standards Board? How in the world do you think they are in a position to do that? Again, the absurdity of all of it is kind of mind-blowing. And I'll tell you what, you think this amendment undermines the board. Frankly, I think this board is undermining the solvency of our nursing homes across this state. And you know what? When you've got 3 providers up against 3 union reps and 3 Democrat commissioners, I don't have a whole lot of hope for our providers that they're getting a fair shake. I don't have a whole lot of hope for our providers that they're getting a good shake here. They don't have fair representation on this board. They don't have fair representation. So thank you, Representative Baker, for acknowledging that while these nursing home facilities are receiving these loans because they have proven that they are financially distressed to the extreme, they are at risk of closure right now. They literally cannot pay the bills that they already have. We need to pause on adding more bills to their plate. Because that's what we're doing. This board is undermining the solvency of our nursing home facilities. And we as a legislature have an opportunity to say that, you know what? There are some nursing home facilities, likely at least 54 of them in the state, who cannot pay the bills that they already have. This is not the time to add additional burdens, financial burdens, to these facilities. We already know they can't pay the bills. We already know that. It's not a question of whether or not they can do it. They can't. And everybody wants to talk about this VBR, the value-based reimbursement. It's 21 months behind. So no, the facilities who are in the midst of this loan program, they're not getting paid for what they are paying. Not now, they're not. Not now, they're not. And so this amendment, it doesn't say that they are exempt from the Nursing Home Workforce Standards Board altogether. Gives them 365 days. In fact, interestingly, that's probably going to be just about enough time after they've repaid their loan, gives them an additional 365 days. It probably just about gives them time to catch up on the value-based reimbursement. But the way the underlying language, the way that current law sits with the standards that are adopted by this new board, we are driving more nursing homes to closure. That is the effect of what we are doing here. We are driving nursing homes to closure. And this is yet another attempt at a lifeline to give them a shot. Thank you, Representative Baker.
Further discussion. To the author of the amendment, Representative Baker.
Thank you, Madam Speaker. I guess, again, I just wanted to remind everybody, everything that has been happening the last couple of years has been harder and harder and harder to be a job creator, a job owner, a job manager, to hire and keep people because of the mandates coming at us. We haven't even talked about paid family medical leave here and how that's going to affect this industry. We haven't got to that. And what I've heard recently on that issue is that they're going to probably have the commissioner start making a decision before it even comes out of the gate. It's going to be higher than 0.7, that what you all sent it off last year with. Let's just use round numbers. It might be 1% of the payroll. Do you know that already 82, 83% of their total budget is for labor and for salaries? It's for everything that it does to take to run a nursing home. 1% is, if there's anything left on the bottom, it was that. And now that's going to be gone with some new mandates because you think that that is so needed. I just, again, there could have been so many better ways to handle that one. Earn sick and safe, same thing, another mandate. Members, we got to get serious about helping our employers, the business operators, the folks that are trying to hang on. These are getting harder and harder with the Nursing Home Workforce Standards Board. More rules, making it harder. We're not getting this thing closely to being resolved and solved. So again, I urge to take this to conference, keep talking about ways of helping those distressed, loan-approved nursing homes to get a little bit of a break with the extra rules on top of what's already there. Please vote green, members. Thank you.
Seeing no further discussion, the clerk would take the roll. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, no.
Carroll, no. Cagle.
Cagle, no.
Cagle, no.
The clerk will close the roll. There being 59 ayes and 70 noes, the motion does not prevail. The amendment is not adopted. There's another amendment at the desk. The clerk will report the amendment.
Franzen moves to amend Senate File Number 5335, the unofficial engrossment as amended. The amendment is coded A14.
I recognize the author of the amendment, Representative Franzen.
Thank you, Madam Speaker and members. I am very excited to ask for your support on the A14 amendment. First, before I go into the amendment, I'd request a roll call, please.
Seeing 15 hands, there will be roll call. Representative Franzen.
Thank you. Members, we have a crisis on our hands, not only on the nursing home level, but we have a crisis at the border. And so, members, this amendment would require the state to contract with a third-party vendor to do a count of the number of illegal aliens present in Minnesota. Minnesota, like all other states, are feeling the effects of the Biden administration's failed border policy. But the issue of illegal aliens is even closer to home than the southern border. Basically, members, we have a blinking light on this state saying if you're here illegally, come to Minnesota. Minnesota's got lots of taxpayer-paid benefits for you to enjoy if you come to Minnesota. For example, the DFL has introduced legislation and held a press conference on becoming a sanctuary state. The DFL has introduced legislation to make illegal aliens eligible for unemployment benefits. The DFL has also introduced legislation to give illegal aliens a monthly benefit under a universal basic income program. The DFL has passed legislation that will make illegal aliens eligible for Minnesota Care. The DFL has also passed legislation providing grants to illegal aliens to help them try and get legal status. Hennepin County is paying to house illegal aliens at locations across the Twin Cities suburbs. Members, eventually, this house of cards is going to tumble. For the Minnesota Care provision, the program is estimated to cost, I believe, $2 million. What is it? Hold on a second. $8 million the first 2 years of the program, and then we'll jump to over $100 million 2 years after that. And that was just in 2023 when that was passed. And we have had lots and lots of traffic coming over the southern border. And who would not want, after seeing this headline from CNN, September 9th, 2023, undocumented immigrants in Minnesota can apply for driver's licenses in October of that we just had last year. But that's just another incentive for those to come to Minnesota if they are here illegally. So members, that's what we do. That's what this is going to do. We need to have an accurate count of how many are here illegally so that we can inform the taxpayers how much more burden they are going to have with higher taxes, which right now they're already complaining about because we raised taxes by $10 billion last year. That was after squandering a historic budget surplus of $17.5 billion, of which last year and this year we are rewarding those who have crossed the southern border and made their way to Minnesota illegally, and we are rewarding them. So members, please vote yes on the A14 amendment. Thank you.
There's an amendment to the amendment. The clerk will report the amendment.
Nor moves to amend the Franzen amendment to Senate File Number 5335, the unofficial engrossment as amended. The amendment to the amendment is coded A18.
I recognize the author of the amendment, Representative Knorr.
Thank you, Madam Speaker. Quite frankly, sometimes it's troubling when we hear terms that are dehumanizing. When we made the commitment in my committee that we'll never use that term, I was serious enough. Members, where is our humanity? Where is our compassion? We need to see other people as human beings. They may have come here in a different setting, like many of us. When we understand the challenges that we're facing, I think sometimes we forget. I'm reminded of Tommy Rukavina, who, when he wrote his letter the nurses, the doctors, the housekeeping, that were from different areas, who had different accent, that when he talked about, it's puzzling to see our children, our families, forgetting their history. When he talks about the wonderful things about the contributions made by immigrants in our state, knowing that he said that I'll be in a 6 feet underground, knowing that that letter came at a time when he's no longer here. We need to look at what contributions are made by immigrants in our state. We have got more than 500,000 who are contributing to the state's economy today. When you look and compare the workforce entry right now, more than 20% are new Americans who are doing the job. Members, when we look at the farmland that we are utilizing, whether they're legal or undocumented in our farms, while they're working and taking care of our elderly, more than 50% of those who are working in a healthcare industry, in a nursing home and other facilities are new Americans. We need to treat people with dignity and respect. So I think this amendment is simple enough and say, let's recognize the contributions of new Americans to the state of Minnesota and look at what they have done. So we're looking at those who are working in the long-term care, because this is not about the Department of Homeland Security. We're talking about the Department of Human Services. And this amendment will ensure that we can do the counts of those who are working in the long-term care so we can show their contribution to the state. So I ask you to vote for the amendment to the amendment. Thank you so much, Madam Speaker.
I recognize the member, Representative Johnson.
Madam Speaker, members, please vote down this amendment to the amendment. It doesn't do anything. Now, the underlying amendment, that does. I myself have no problem with the legal immigration to the United States. There's a process to do it. I have friends that have done it. It does take years. For those of you who don't know it, since the Biden administration took over, we're averaging at least 2 million illegal border crossings per year. We're now sitting at about 8 million. Oh, that's right, the population of Minnesota is only 5.7 million. We've had more border crossings than the entire state of Minnesota population. And Minnesota is one of the top 5 states that they're moving to. We need to know how many are here. Because if they cross the border illegally, guess what? They will not be in our nursing homes working. They cannot work here. In the housing bill, they changed stuff so they possibly can actually get state tax dollars for housing. We need to know how many are living here, because these are this is taking money out of the taxpayers' pockets of Minnesota. Like I said, I have no problem with those that come here legally. There's a process. Some say it's broken, but nobody can tell me what's broken. I've asked. What's broken is the fact that the Biden administration is not following our federal laws on immigration. And it's hurting the citizens of Minnesota. If you want to come here, do it the proper way. But we need to know how many people that are here illegally in this country and in this state, so those that want to come here the proper way can actually come here. Because the number that come here illegally affect that those can come legally. Please vote down this amendment to the amendment.
I recognize the member from Douglas, Representative Franson.
Thank you, Madam Speaker. And before I discuss my talking points here, I'd like a roll call.
Seeing 50 hands, there will be roll call.
Thank you. I am reminded of when President Biden referred to illegals in his State of the State Union. And so if that language is acceptable to the most popular president we've ever had with 81 million votes, more popular than Obama, then certainly the word illegal aliens is acceptable for the Minnesota House of Representatives. And so also, I do not believe we are supposed to impugn motives. So to hear Representative Noer use the term dehumanizing, that the motive is to dehumanize, that certainly was not the case. We're just using language, and government cannot control speech. We do have the First Amendment right for a reason. But back to the amendment at hand, Representative Noer's amendment, it is worthless, it is nothing. We do not care about legal citizens, legal immigrations, we do not care. This amendment is really ridiculous in nature, and so members, I ask you to vote no on that. And the real issue at hand is to get a good count of those here illegally so that taxpayers have an idea of who they are paying for, what they are paying for, and where their tax dollars are being spent. Thank you, Madam Speaker.
Further discussion. The author of the amendment, Representative Noer.
Thank you, Madam Speaker. I think you've heard from different viewpoints. When you see the first generations immigrants who come here pay more taxes than the any benefits that they receive, even to Minnesota Chamber of Commerce, as they said, in reality, this group doesn't represent a significant cost or burden to the taxpayer's bottom line. That's exactly what is quoted from the Minnesota Chamber of Commerce. They understand the reality, so please vote green on this amendment.
Seeing no further discussion, the clerk would take the roll. Members, please vote. The chief clerk will call the names of the members voting remotely.
Carol.
Here you go.
Carol, I.
Carol, I. Cagle.
Cagle, I.
Cagle, I.
The clerk will close the roll. There being 69 ayes and 60 noes, the motion prevails and the amendment to the amendment is adopted. To the underlying amendment, the A14, discussion as amended. Representative New Brindley.
Thank you, Madam Speaker. It's funny what we do around this place. It's funny what we do. We took an amendment that frankly made a lot of sense. It's important for us, particularly when it comes to the Department of Human Services. The Department of Human Services, this is the department, this is the state department that pays for things like Medicaid, the largest part of our state budget. And that includes, Democrats have ensured that includes paying for illegal immigrants, for illegal aliens. And again, Representative Franson, thank you. It's not our language. This is literally the language that the federal government uses. We're not dehumanizing anyone. This point-in-time count, in fact, it's very similar to what we do for homelessness. Every year, there is a point-in-time count done where they go out and they literally count how many people are unhoused in the state of Minnesota. Point in time count. It was a really good idea to do that for illegal immigrants because right now we don't have that data. There are lots of estimates on that data. In fact, just yesterday I was reading an article that estimated over 4,000 illegal aliens in the state of Minnesota. It's a massive number. And there is a cost to the state. And we should be able to quantify that. We should have that point in time count so that we can quantify the cost. And Representative Nord, this is lovely. There are a lot of wonderful immigrants. Again, I worked in nursing homes, and you're right. There are a ton of immigrants serving our elderly community right now. They're doing a wonderful job, and we are grateful for them. And we are also grateful for the fact that they stood up to be counted, that they came to our country legally and lawfully. And the fact that they are working tells you that they are not illegal immigrants. But you like to obfuscate. You like to put them all in one bucket. Immigrants. That's not what we're talking about. We are not talking about our immigrant community. They provide a phenomenal service to the state of Minnesota. What Representative Franson's amendment addressed is illegal aliens. People who are in our country illegally. They do not have the right to work in our state. In fact, it's kind of funny. We hear the opposite side of this all the time, right? When we bring forward amendments in regards to workforce, we're told, no, we don't need those because illegal aliens can't work. But then when we say, hey, we want a count of these illegal aliens, we're told, no, we love immigrants. They provide all these jobs. They fulfill all these jobs for us. We're not talking about the same thing. We are not talking about the same thing. There is a cost to the state of Minnesota to provide services through the Department of Human Services to illegal aliens. There is a cost. And without a count, we have a very difficult time quantifying that. But we should. Minnesotans have a right to know. Minnesotans have a right to know how much of their tax dollars are being used to pay for these services for illegal immigrants, for illegal aliens. That's what we're talking about. We're not talking about lawful immigrants. So while you try and try and try to put them in the same bucket, they're not. They're not in the same bucket. One group has done it the right way. They have come to our country lawfully. They have chosen to follow our rules. And because of that, they are able to be gainfully employed and provide a service, enhance our workforce. Another group, illegal aliens, have come to our country illegally. Their mere presence in our state is an illegal action. And it is costing taxpayers money, and taxpayers deserve to know what that is. It's unfortunate that we have gutted the Franson Amendment because it actually would have provided a service. It actually would have given us some data that would be helpful in making decisions, that would be helpful in appropriating money. And instead, with the Noor Amendment, I don't even know what it does. We get to take a victory lap on immigrants helping our workforce? I assure you, you don't need to take that victory lap. We're all thrilled. We are all thrilled with their presence in our country. We are thrilled that they have chosen to come to our country legally and that they recognize the greatness of America and that they want to be here. We are thrilled. So I don't know exactly what your victory lap is going to accomplish, but it certainly does nothing to serve the people of Minnesota. It's unfortunate.
Further discussion. To the author of the amendment, Representative Franson.
Thank you, Madam Speaker. Members, thank you, Representative Brindley. That was well said. You know, this last legislative cycle, this last budget, we increased spending here by almost 40%. Almost 40%. That, members, is unsustainable. And we are facing a budget deficit this next legislative cycle. A budget deficit. So you've increased spending by nearly 40%. That's with squandering a surplus, raising taxes, and we're facing a deficit. And your priority is to have taxpayers funding illegal aliens. And all we're saying here is, give us a count. Let us know what we are working with, because the taxpayers deserve answers. They deserve to know exactly where their tax dollars are going. Just the Minnesota Care expansion, allowing illegal aliens to have health care, is going to cost over $100 million as a starting point. And that doesn't even go on to say how much we're going to pay for college, any other government stuff we're giving them, paid for by the taxpayers. So it's extremely disappointing. And yes, if you're here legally, congratulations. That is the right way to do it. But Democrats here want to reward those who are here illegally on the backs of our hardworking taxpayers. Madam Speaker, due to the ridiculousness of the newer amendment being tacked on to my amendment and just totally gutting it and making it laughable, I request to withdraw the amendment. Thank you.
Representative Franson withdraws the A14. There's another amendment at the desk. The clerk will report the amendment.
Zalesnikar moves to amend Senate File Number 5335, the unofficial engrossment as amended. The amendment is coded A15.
I recognize the author of the amendment, Representative Zalesnikar.
Madam Speaker, members, the A15 is transferring the $2 million slush money that we've been talking about to the EMS, Emergency Medical Service for Rural Minnesota. Right now, we know that this is directly going to move the money to the non-medical transport runs. One of the things I learned being on the Emergency Medical Services Task Force is that 70% of the runs have nothing to do with an emergency, which was really shocking to me. So imagine using the most expensive model. It's similar to having our seniors be forced to go to the most expensive model, being the nursing home. With ambulance runs, if seniors or any citizen is using the ambulance for things that are not the E in the EMS and emergency, but they're using it for just basic transportation needs, it was shocking to me to see that 70% is used for non-emergency transportation. It tells me right there we need a solution to a real problem. And the problem is there's not adequate non-emergency transportation in greater Minnesota. And that's not new information. It's not a new problem. And so, from my perspective, it's irresponsible to allocate DHS with a $2 million slush fund when we know we have serious transportation issues for greater Minnesota. And not addressing it is not a solution. not addressing it just means we are going to further stress the emergency side of our equation for the EMS with ambulances 70% of the time, tying them up for non-emergency events, which means they're not going to necessarily arrive for what your emergency event is timely. So, members, I would urge you to vote green to allocate this $2 million slush money to a huge issue in Greater Minnesota that requires a solution for non-emergency transportation. Thank you.
Discussion. I recognize the member from Hennepin, Representative Knorr.
Thank you, Madam Speaker. I've got a news flash. There's no money left there. It's gone. We've already used it. And so trying to spend that funding in there does not make it so. So members, we're not talking about a slash fund. It's a contingency account fund in terms of if there's an emergency, the Department of Human Services can react quickly. So now knowing that most of that fund is gone, what we have left there does not even pay for this emergency service program. But I've got a good news for you. We've got a bill coming up tomorrow to address the same issue. So I'm hoping that we can work together to make sure that we successfully get that bill tomorrow. So there's funding for the emergency services that we're requesting in this amendment. So please vote no on this amendment.
I recognize the member for Olmsted, Representative Quam.
Thank you, Madam Speaker. And because I know there are unfilled positions, there is extra money that'll be present in the budget. And maybe we can actually have things to spend it on. And I'm sure the conference committee will be able to work it all out since they have all the additional information that many of us haven't been able to receive or are just receiving now, a little bit late for amendments, a little bit late for working it in. But I'm sure you can make it happen. Vote green.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. I think we just heard a moment ago the one thing that Chair Knorr and I agree on. Newsflash, there's no money left. We've already spent it. Truer words have not been spoken in this chamber. Because last session, we had $17.5 billion. The Democrats added $10 billion in new taxes. They had almost $30 billion to work with. And now here we sit trying desperately to fund essential services. That's what we call misplaced priorities. We are trying to scrape together a few $1 million to pay for EMS services because you are correct. Newsflash, there's no money left. We've already spent it. That should literally be on a billboard signed the Democrats. $30 billion, $730 million on a palace for politicians to fix a leaky roof and an HVAC system. And now we are trying desperately to find money to pay for essential services. We're trying to fund EMS so that when someone picks up the phone because their loved one is having a heart attack, there's someone on the other end who can come and help. But newsflash, there's no money left. We've already spent it. We already spent $30 billion without funding essential services. Ironically, I'm sure EMS would love a really nice chunk of money, but boy, they would take a small fraction of that palace for politicians over there. they're not even asking for a tenth of what we're paying to fix that leaky roof. Not even a tenth. Not even close. So, I agree. Newsflash, there's no money. You spent it all. Truest words we've heard all day. The truest words we've heard all day. And thank heavens the Democrats have chosen to take Representative Baker's amendments. Because I tell you what, when we heard in committee that the Democrats wanted a slush fund for DHS, in fact, the department was asking for $10 million. They wanted $10 million to do whatever they wanted with. Now, Chair Knorr chose to give them $2 million, which was much smaller. But I sure hope that there's an actual commitment to make the changes that were made today. I sure hope that that is an actual commitment. Because it's true. There's no money left. They've already spent it. But I sure hope that you figure out how to come up with some money for these essential services. Because when Minnesotans pick up the phone to call 911 because their loved one is having a heart attack or something else, they're certainly in the worst circumstances. In those moments, they need to know that those services are available, that help is available, that help is on the way. This is our obligation. This is our obligation to figure out how to fund these services. So thank you, Representative Zalesnikar, for the amendment. I will certainly be supporting it.
I recognize the member from Isenti, Representative Johnson.
Madam Speakers, Representative Zalesnikar, thank you for this amendment. I'm going to give a little story about things in my county. When the ambulance services has no runs going, which isn't very often, we have 2 ambulances. My county's got a population of over 42, almost 43,000 people. But those 2 ambulances doesn't just cover Isani County, they cover northern Anoka County as well. 2 ambulances for 1.5 counties. There's times that we have no ambulance. Because if they do a transport or transfer down to the metro, guess what? They might spend 4 hours and about 6 runs down in the metro before they're able to come back north to cover their assigned area. So while they're running around transports down here, we have no ambulance in my county. I'm very thankful for our fire departments who have stepped up and run emergency medicals, because more than once, they've loaded an emergency patient into a fire truck and brought them to the hospital because they didn't have 45 minutes to wait during that medical emergency to get a person to the hospital. As Representative Baccaros knows, there's the golden hour. Representative Hewitt knows it as well. Or I should say Hoyt. You have that golden hour to get a person to the hospital for that emergency care. Now, when the call comes in, it takes maybe 10, 15 minutes for the fire department to get there, depending on where you are. But then you have another 45-minute wait for an ambulance, your hour is gone. We can't wait that long. These funds are needed to help our ambulance service, especially in greater Minnesota. where that golden hour is so important. Representative Zelenskar, thank you for this amendment. Members, please vote yes.
I recognize the member from Hennepin, Representative Bonner.
Thank you, Madam Chair. And thank you, members. You know, I wanted to just kind of speak up a little bit about something because it feels like there's a really strong misunderstanding of what the word contingency is and what it means. Now, I've been in project management for about 20 plus years. And one of the fundamentals of budgeting is that you always have a certain account or a certain amount that you allot for contingency. And what do you use contingency for? You use it for unexpected expenses. You use it for emergencies. You use it for things that you can't necessarily account for. And specifically, in this case, this account is used to respond to emerging or immediate needs related to supporting the health, welfare, or safety of people. That includes services, supplies, and equipment, training, coordination, and service providers to tribal nations and local governments, communication and outreach to impacted people, information technology, staffing, and yes, including transportation services. For the folks who are actually receiving those services to be transported for critical medical needs, I'm pretty sure they wouldn't look at this as slush fund. They would look at it as necessary to their everyday lives. They would look at it, in some cases, as critical to saving their lives. So I just want to be clear when we say contingency. This isn't money that we just left lying around for no particular purpose. It's there for a reason. Now, that said, we just took a large sum of money out of this account earlier by accepting the Baker Amendment. And I just want to say, Representative Baker, we truly appreciate your contributions in committee. We truly appreciate where you stand on these issues. I am grateful for your contributions. We took that amendment, but we took it out of this contingency account. And now we have members on the other side of the aisle screaming about how we shouldn't, we should be spending this money or not spending this money and what we should be doing with the money. And we've bankrupted the fund and it's all our fault. Because we actually said, you know what? One of your members has a priority that we think is worthwhile. We agree. It's worthwhile. We agree that the hard work that Representative Baker has put forward was important. So we said yes to taking money out of that account. An account that has a purpose, that gets used. And you've spoken to the spreadsheet, so you know where the money goes. So it isn't just a slush fund of money lying around. It's money that's actually being used by real people across the state of Minnesota. And it is there for a reason. So this idea that we're just leaving dollars lying around for no particular purpose is blatantly and patently false. Not only that, I just want to remind us that we took money out of that account to pay for something important to folks on that side of the aisle, including Representative Baker, whom I have a great deal of respect for. So let's not act like this is not important. Let's not act like folks just don't care, because that was patently false. It is important that we need to move forward on this bill today. There is important work being done here. Thank you, members.
I recognize the member from Traverse, Representative Baker. Oh,
Close.
Sorry, Backer. My apologies. Representative Backer.
You're not the first and you won't be the last. Thank you, Madam Speaker. Thank you. You know, each day in Minnesota, we have on the average 1,660 individuals who dial 911. From north down to the south, east to west, and that is including on the western part, the district I represent, that hump, bump, tip, elbow, nose. And of those runs, on the average, these are average numbers, we have roughly 332 runs that are non-transport. That can be just a lift assistance. And for a few of the EMTs or paramedics who are listening, sometimes you have what we would refer to as taxi runs, because we're there about once a week. And actually, those individuals do need to start to get into a nursing home, and we've had to help those individuals to get to that point. But we also have the non-transport runs, is we heard earlier today, if someone has a heart attack, and if you had a helicopter that flew in to that scene and then picked up that person, even though that ambulance was there helping, providing CPR, oxygen, advanced airway, that ambulance, if it's a Medicaid or Medicare, doesn't get the reimbursements that they should, because as Representative Hewitt and I have discussed it extremely many times over the last couple of days, you don't turn in the wheels. And that's wrong. Every single Minnesotan, doesn't matter if they're in Traverse County, which is the smallest populated county in the whole state, 3,200 people, to someone in Hennepin County, which is the largest populated county, should have the right to have the same care. And we don't always know when we get there. There are people who call because, quite frankly, they're just confused on what should be done in an emergency situation. So this is a very good amendment because it starts to help with those non-transport. Why are they so important? Because we still have to get the rig out of your garage. If it's a volunteer, I still have to get up 2 in the morning if I'm on call. If it's a paramedic, we still have to pay those fees, because those individuals are, even though it's a loved one of yours, and most of the individuals who serve in this industry serve to help people, we need those resources to buy the pads for the defibs, to buy the advanced airway, or just to have oxygen, or have a warm blanket when we put them in the back of the rig. Put gas in the rig. We need that money for those resources. So, good amendment. Vote green. Thank you, members.
I recognize the member from Dakota, Representative Hewitt.
Thank you, Madam Speaker and members. Thank you, Representative Zliskar. You're a member of our task force. I appreciate that. And you learned. And Representative Backer, I can't say enough about the service you have given this state, and we really appreciate that. Members, you're going to hear a lot more than you ever wanted to this week about EMS. And this is probably just the beginning. I saw this amendment today, and I go, it's starting early. So members, this particular amendment, I'm going to ask you to vote down on because there is negotiations going on that would cover a situation like this. Tomorrow you'll hear more about the agency, but today this would not be the appropriate place to take these funds. We're behind the 8 ball. We're totally behind the 8 ball in Minnesota. I am going to say something that should disgust all of you. Mississippi put a law in place last week on treatment non-transport. Mississippi. Why is that? They beat us to the 8 ball. Oh, sorry, they beat us. I really think that we got to rethink this because we're in they always say you don't want to make decisions when you're in a situation where you're emotional. And that's where we're at. And I know all of us are there. We're all afraid that when we go home and we have to call the ambulance for one of our family members or maybe for ourselves, that it's not going to come. Or if it comes, it's going to take them 30, 60, 90 minutes. Those are all true response times in Minnesota. And we have to stop that from happening. This is not the amendment that'll do that. As much as I appreciate it, I think you're going to have more opportunities. I know you're going to have more opportunities down the line to fix the response times and to fix the reimbursement for our local ambulance services. Thank you, members. Please vote no.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. Just a couple of quick things. On this contingency account, let's be clear. It's true that we did not leave money laying around for no particular reason. The Democrats left it around laying around for any particular reason. That is the definition of a slush fund. You look at the language in the bill, and they can use it for anything they want to use it for. That's a slush fund. Now, as to this, you know, it's unfortunate, and Representative Hewitt, I really appreciate your work on this, because it's going to benefit our rural communities more than anybody. It's our rural communities. I mean, frankly, it's a problem statewide, but our rural communities are really in a world of hurt on this. But this idea that we're behind the 8 ball, this idea that somehow Mississippi beat us to it, it's because Mississippi made it a priority. And Mississippi didn't have $30 billion extra dollars to do it with. They made it a priority. And we have not. You spent $30 million and now you're trying to scratch together a little money for essential services. It's wrong. It is wrong.
Further discussion. I recognize the author of the amendment, Representative Zaleski.
Thank you, Madam Speaker. And members, there's a lot to talk about when we're talking about health care, as we've spent the whole afternoon doing it. And there's serious topics at hand, whether it's assisted living, nursing homes, and of course, who's going to respond when we call 911. So I respect and appreciate Representative Hewitt, your work on EMS, and my colleague Jeff Backer. And we have a lot of work to do to find solutions. And I look forward to what's coming for rural health care for greater Minnesota on non-emergency transportation. To the point made about contingency, I listened carefully, and I appreciate money going to Rep. Baker's bill, Amendment 2. These are all really critical things. I think fundamentally where we're at is just a crossroads of priorities of what is really critical for the state of Minnesota. And the reality is we did have a lot of money, $17.5 billion, and we've got another 3.5, I think, sitting there now this year. So having a lot of money hasn't been the issue. Spending a lot of money has been an issue. And when I look at it, a contingency account is there if we have an emergency. Well, we got a huge emergency, Minnesota. We have a huge emergency that has been documented since 2002 in ambulance services. So I don't know what we're waiting for, because the emergency's been before us in multiple reports. So if we're gonna ignore the reports by the Office of Legislative Audit and just do more studies and more things, we can keep doing that game for years. But the reality is the crisis has been here, and we've waited till it came to the pinnacle point where we actually see them fall off as providers in rural Minnesota. So it is this body's responsibility to take action, because kicking it down the road isn't going to work anymore. And so we have huge priorities that are required of us as legislators to look at what is a priority and what is a want and what is a need. I think everybody needs ambulance services. And if we're going to have effective health care, everybody needs non-emergency transportation, or our cost just gets transferred to the highest level of care, which is the hospital, which is the ambulance. And so because we haven't done better, we're in this situation today where we must do better now. And now we have less money to work with and a huge issue to deal with. So I appreciate being on the task force for emergency medical services. It's just unfortunate we're dealing with this after $17.5 billion was spent. We're dealing with a problem after we knew we had a problem for 20-something years. So excuse me for being frustrated, but when I look at it coming in as a new member of this body, it's shocking to me that we're in 2024 and we have data for 20-something years and we still have just kicked it down the road. So now, you're right, we've got a huge boondoggle to deal with. But we need to make sure we have ambulance services for the entire state. So I urge us to look at this hard as we have discussions this week, because we are in a situation where if you plan on traveling north, you might want to stay tuned. Members, I urge you to vote yes. Thank you.
Seeing no further discussion and there being no roll call requested, all those in favor of the A15 say aye. Aye. Those opposed say no. No. The motion does not prevail and the A15 is not adopted. There are no further amendments at the desk. The clerk will give its bill a third reading.
Third reading, Senate File Number 5335, as amended.
Third reading. Discussion. I recognize Representative Backer.
Yes, Madam Speaker. You know, one of the things that we are seeing in this bill is, unfortunately, with the opioids, we did not take that amendment. We really need to be investing in those treatments for individuals who are experiencing those abuse. Now, what we're seeing is one of the greatest challenges that we're seeing in this is, again, a lot of one-time funding for nonprofits, for new grant programs, which is irresponsible. It really is. It's unaffordable because it's not long-term. We have programs that work well, and we also have had good amendments, good bills, draft bills for mental health that we really need to be putting more money into, investing. And probably the greatest challenge that we saw, which we had a lot of debate this afternoon, is what we're doing with our seniors. And again, they are getting the short end of the stick, and that's wrong. So members, I would ask to vote no on this, and thank you.
I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Madam Speaker, and thank you, members. First, I want to thank Chair Noor. He's not here, but thank him for the Committee for Health and Human Services. There's a lot in this bill, and there's some things that I like in the bill, and I've been working with the hospitals on their issue to discharge people. We have people that have been waiting. We have 50% higher civil commitments. We have people that have been waiting in hospitals for tremendous periods of time. I've traveled to St. Peter to see this. I've traveled to Care Carlton in Carlton, Minnesota to see the substance use disorder place. And we talk a lot about downstream, but we're really just shuffling the table and chairs a little bit here, because from what I can see with the issues facing Minnesotans, we need that front entry with substance abuse, places for treatment, and I do not think the one in southern Minnesota should be closing, and I do not think the Care Carlton should close, and that Care Carlton has been saved at this moment, which was the only facility in the entire state for all women. So that was a really important moment for Care Carlton to be saved, but make it be known that we need to be saving all these programs. To eliminate programs that help people at that substance use disorder is helping the whole big picture in that healthcare continuum. And how I see this is we're adding 10 beds. We're only adding 10 beds for the hospital, which, from my perspective, coming into a session with $17.5 billion, knowing that hospitals have been screaming at the top of their lungs long before we started session. Hennepin County has been doing weekly reports for all of us as legislators. It is an absolute drop in the bucket, and it's not going to affect the numbers that we have. It's irresponsible, in my mind, as a legislative body, to be talking about 10 beds. 10 beds. When we have absolute record crises, we have 40% increase in mental health, we have hospitals that cannot do admits, we can't find placement, and the best we can do in the state of Minnesota that's supposed to be the North Star is to give 10 beds in a care level that is complex care, similar to the nursing homes. So what I see as a past nursing home administrator and person who has staffed 24-hour facilities for 30 plus years, we've really abandoned the places that need it the most. Care centers, abilities to make sure we have it funded from young to old. And when I see that the method we're going to is a 9-member, we've got a nursing home board to be the solution for the problems in the nursing home, as if nursing homes weren't fined $1 million during COVID, as if assisted livings were not fined $3 million in COVID, as if nothing should have changed between a pandemic for surveys versus when we weren't in a pandemic. We allowed our health department to survey, let this sink in, the nursing homes that we knew had no staff and the assisted livings. We said, you know what, game on. You go right ahead and give them that IJ deficiency. And you know what? They did. They did. They made sure that Minnesotans know that care isn't happening to the standards that the regulations were written. In fact, in 2019, do you know how many IJ, that's the highest, the worst deficiency you can get in a nursing home? We had 63. In 2021, we had 123 IJ tags. That's the worst tag you can get in a nursing home with the highest fine per day. 2022, we had 127. So a third of our nursing homes got nailed with thousands of dollars of fines, thousands. And we, as a legislative body, just kind of turned the other way. No big deal. Fine them. Make sure we can document that they're doing something wrong. And no worries, we're going to create a new nursing home task force board because that's exactly what the solution's going to be. Not one of those programs is going to provide care to a resident in Minnesota or change the model that we have right now. But it's going to make us think we did something. And the reality is we had child care stabilization grants that were also meant for one-time things. We renamed them. We rebranded it as a Great Start Scholarship, but it was really moving money from that was supposed to be one-time because we can see the same problem. We have a child care problem. We have a staffing problem in hospitals and nursing homes, and we acknowledged it. So what was set up to be one-time with the child care stabilization grants, we as a body said, you know what, no, it can't be one-time. But yet for nursing homes and assisted livings and even these substance use disorders, we're just okay with saying, you know what, let it fail. Let it fail. We'll keep racking up the fines. We'll keep sending out the surveyors. We'll add more ombudsmen to give us reports to say they're doing it wrong. And then we're going to wonder why nobody wants to be in healthcare and work as an aide when we label it all neglect and abuse. So are we going to do the same thing when somebody doesn't respond to an ambulance call when you call 911 and they didn't show up in an hour? Is that neglect? Is that abuse? What is that going to be? Because these are the realities when you don't have staff. That's just the hardcore facts when you don't have staff. We have got to move from a punitive model in healthcare to a coaching model. Without it, we are just going around the tree the same way. The statistics are showing this punitive model is not working. And I hope that this body is going to seriously look at this mentality of just mandate without looking at what the mandates are is an absolute train wreck. And so, members, because we're eliminating the elderly waiver, we're going backwards in time. We're going back to the model that started really for some of these assisted livings in the 2000 when I started the assisted living. We're going right back to a model where we're not going to be able to serve as many at a time when we have more people on medical assistance than we ever had before. When I first started, we had about 80% private pay, 20% medical assistance, elderly waiver. Now it's flipped. So providers are going to have to cut the amount of beds and cut the numbers that they can take for medical assistance and figure out how to redistribute the staff, which means we won't be able to serve as many people. So for these reasons, there are some good things in this bill, and Chair Noer, I've shared that I appreciate that. The fact of the matter is, with $17.5 billion, The human service needs of the state were disregarded. You don't go for a historic surplus without allocating to your priorities, which should be the young, the people that have these mental health needs, that are sitting in hospitals and jails, and the seniors that built the very state we're living in today. And that did not happen. And we have the issues are going to keep going. And we're going to see more closures, and we don't have enough child care units, and we're shipping kids to Fargo because there's not behavioral health inpatient beds. We haven't changed that, and adding 10 beds for direct care and treatment to take them out of the hospitals is really a little tiny drop at the sink for what we're dealing with. So for that reasons, I cannot support this bill. While I support many initiatives in it, I cannot support this bill, knowing that we had a $17.5 billion surplus, and I will be voting no.
I recognize the member from Olmsted, Representative Quam.
Thank you, Madam Speaker. And I decided to pass on just three small little articles about, the fraud. And I noticed somebody sent something with long-term care imperative, which lists several sites losing huge amounts of money. And frankly, just these three examples would pay for 5 years, 6 years, for a couple dozen of the examples that are losing in long-term care. And that's just the ones I put in the ones caught. And I'm glad that some of you are smiling and enjoying the fact that we did catch some of these vile, evil perpetrators that are stealing from the most needy people in our state. People that many of them have worked their entire lives and now ask and need our assistance so they can spend their last few years in a, humane setting with care and staffing. I've got more texts and more messages from people. I'm optimistic because there are a lot of people in these departments that care, workers that are seeing stuff and stepping up. And even though the departments don't seem to be listening, the federal investigators that are investigating these huge fraud issues are. It's nice to hear that even though many tens of millions of dollars was hustled off to foreign countries to hide it, the federal investigators are finding the evidence in countries like Kenya. They're finding the fraud that's been so pervasive. And those watching from home, I've got my fingers crossed that not just the perpetrators, but the facilitators of that evil fraud, stealing from those that have so little and need so much. I just wish that we as a legislature were allowed to make some improvements that would matter. Year after year, we tweak and do little things. And year after year, the audits and press and others and the feds find all this waste, fraud, and abuse. We had an opportunity to try an independent, embedded auditing to see if that would fix it. But apparently, no. I'm optimistic and hope that we can do something. We'll see what comes back from conference committee. Hopefully it'll still include the bipartisan amendments that were added today. And hopefully it'll include some improvements from the Senate. But this bill in its current form is like so many in the past. It doesn't come up to the level that our citizens deserve. I'm going to vote no.
I recognize the member from Polk, Representative Keel.
Thank you, Madam Speaker. Last week I was voting online or on through the phone because my dad fell. No big deal, right? They called the nurse. It's assisted living, and an ambulance had to come. Ambulance couldn't pick him up because there weren't enough people, so my nephew and brother showed up to help them pick him up, take him to the hospital, which seemed to be a minor thing. It turned out not to be, and he's in the nursing home recovering now because hopefully he'll go back to living with my mom in the assisted living. And he got the care he needed, but I'm living this conversation. I'm quietly sitting here listening to all of the things we need to do. And I look at not just my parents, they're in their late 80s, but I'm looking at all the people that I saw over the week struggling to get what they needed in the nursing home or assisted living and helping them when the nurses couldn't. And they're working hard. My nurses are all working very hard, whether it's an aide or an RN. I've watched an RN have a nervous breakdown because she just couldn't handle the responsibility anymore of the demands, the 24-hour demands of running an assisted living. It wasn't just when she was there scheduled, but the 24-hour demands of being called in the middle of the night because, hey, something happened. And I wonder how many people realize that actually goes on. The caring that they do, the extended time. And I'm just really disappointed as I close out my ability to be here on the floor, the fact that we have not figured out a way to help our nursing homes. It's been a conversation in the 14 years I've been here. I'm disappointed with the fact that we haven't been able to figure out some way to work on DHS, and all I see is more and more and more regulation. So when I talk to the nurses and the people that work on healthcare, their frustration, they're scared when they're being, the state is coming in. They're going to be checked over. Sometimes it's actually for a complaint. And I get that. I get that. Someone fell, the state came in to see what these investigated the exact accident. But the point is that the nurses are so stressed that, and the regulators are so focused so that we don't have the damage in elderly that we have heard long time ago, which is really unfortunate. I mean, I don't believe that most of our rural areas have that problem. But there has been some in Minnesota, unfortunately. But these are hardworking people that have worked in rural Minnesota or wherever, the cities too. We have had them employed. They've paid taxes. They are now needing services because they're aging and their body's failing. And we're not able to say, you know what, folks, we'll help you. We'll figure out what it is you need and take care of you. And I think this body needs to really think about what we're doing. We are putting too much into DHS and regulation and too little into what happens in our nursing homes, rural, and our EMS programs. And I just watch these people work their butts off. And truly, when you are talking to a nurse that is in tears because they're going to have some accusation made of them, and things happen in the nursing home, I can tell you that. My dad has said, hey, this didn't happen, and he was really frustrated. And I said, well, Dad, let's look at what happened, what you asked for. And after a while, he understood that that was kind of Maybe he wasn't very clear about what he needed, and maybe the nurse didn't quite understand. So we have those relationship conversations, and they get to know him a little better, and they help him with whatever it is he needs. But I just think we're looking the wrong direction. Representative Zalesnikar, why is that so hard to say? Anyway, your background and what you understand, I just would encourage you to go follow a nurse around for the day, follow an aide around for the day, go help feed residents that can't feed themselves. Go walk them around and talk to them. Go visit with them. There are so many things that our nursing homes, our assisted living, our care places need help with. Just being cheerful and walking in and visiting with somebody is important to them, and they are our citizens too. They're constituents that have worked very hard in the state of Minnesota to provide for our communities and services. So when we're thinking about this, I want you to think about that importance. The same goes for people who have mental health problems, that they have been there, they're contributing, and we need to help take care of them. So we'll see how this bill works out in the end, but I'm really concerned that we aren't putting the priorities where we should be. And I'll leave it at that. Thank you.
I recognize the member from Candy, Ojai, Representative Baker.
Appreciate the conversation today, members. I think that my theme to kind of close it up to is just a lot of appreciation for the work that we're trying to get done in this body. There are a lot of needs in the state of Minnesota. Last year, the decision was made here to spend like we've never seen before, $71 billion, that is a 40% increase from the prior budget session. And I think what we're trying to say today is, as much as we are trying to shake the slush fund, as we call it, or the contingency fund, whatever makes one feel more comfortable, I don't care. But that was the little bit of money that was sort of not accounted for. So a lot of folks over here kind of went after that money because it was not specifically set up for one thing. And I am very grateful for Chair Knorr and his recognizing some of the ideas that I brought to committee, and how this year was really about the sadness in our work this year was to go after the loose change that was left from last year. I don't know what could be more important. There's some really important areas that government has to do. I mean, last year, Chair Joachim spent, the body spent $2.2 billion in education, and I don't think that we here were saying that that was the worst idea. I don't think that we got a lot of like, that was way too much, because we even had an idea of, we just would have done it different. We would have put a lot more to the student formula without all of the mandates that came with it. Because we had a one-time, probably once-in-a-lifetime deal where we could have really done some special things last year. And education was a good one, but I think, again, we swung and missed with a lot of extra mandates. Human services, in my opinion, because I serve on that committee, is where we need to focus our efforts. To me, that is a core function of government. And we, this year, were scrambling for the peanuts left on the ground. I want to say thank you to Chair Knorr, Chair Fisher, and others that worked with me a lot in the world of mental health, in substance use disorder, to try to get some kind of balance with what did get excluded last year, which is a 3% rate increase. We're still trying to work that angle. We're still trying to get there, because I know how important the tails were in this year's work. There's nothing left in the tails, which is future spending. So we'll take everything we can get right now to take it to conference and do that. And there are some really good things in this bill, too, like the reentry program, the 1115 waiver, and the reentry from folks getting out of incarceration. 90 days before they get out, they'll have more tools to work with, some treatment help, medically assisted therapies if that's what they need. But if you're getting out of prison and you've got you've got an SUD background, if you've struggled with drugs, we are there to try to help you more than ever before. It's a pilot project. It's a small project, but it's something, and the federal government is helping with some of that. That's a good thing. In fact, again, I was so desperate for money in committee, I suggested we don't do that program because it was pretty spendy this year. It's $4 to $8 million, maybe $12 million going forward, which doesn't seem like much when you think about this year, but that's the total budget target this year was about $43 million for the whole committee. So I was suggesting to the commissioner at the time, we should wait on this stuff because we don't have the ability to take care of the core stuff we should have done last year. So we've heard of it today, and now tonight, that this is about missed priorities last year. I know that when the governor came and talked about closing down a couple care centers around the state of Minnesota, those are some very intense recovery sites around the state. There's one up in Carlton, one in St. Peter. And I want to thank the majority as well in that committee. We all said, what are you doing here? To the governor's staff and his ideas about closing those down. And I want to say that when I sat down with Representative Dotseth about, did you kind of know this was happening? He doesn't serve on our committee. I saw his head completely do a 360 because you couldn't believe that that care facility for women only was being proposed to be closed. And Madam Speaker, if I could, would Representative Dotseth just yield for a question?
He will yield. Representative Baker.
Thank you, Madam Speaker. Just, Representative Dotseth, if you could give us a quick, time is of the essence, but just give us an update of what you were able to learn and how important it was, because I do want to close that out too. So thank you, Representative Dotseth.
Representative Dotseth.
Thank you, Representative Baker. Thank you for asking. You know, Care Carlton is probably one of the best kept secrets in the state here. I was shocked to learn, number one, is I don't serve on the committee, so number one is that was something completely new to me. But number one is I learned that Minnesota is one of the top 3 states for trafficking in the world, in the United States, which is shocking. Care Carlton actually had some of the best staff on the planet. And realizing as I toured that facility, that's a facility that cannot go away. At a time that we've got an uptick of mental illness, we've got an uptick of drug abuse. It's the only center in the state that actually services women that are pregnant. Why would the governor consider even closing such a facility? At a time that we actually had a $17.5 billion surplus last year. We blew through that. We had additional $10 billion on top of that. We went through that, increased spending by 43%. But I do have to say I want to thank Chair Knorr for his help on working on that facility to help keep that open as well. It was really a concerted effort to navigate through this, and it was a team effort. I was shocked, Representative, once I found out that they would even consider closing such a facility that provides such a tremendous asset to not just our community, but to the state of Minnesota. Thank you.
Representative Baker.
Thank you, and I appreciate that. And I was also going to make sure I appreciated the work of Chair Nord, recognizing that was probably a big mistake because we were able to find those dollars that were planned to be cut by the agency and the governor. And I just, again, I'm glad that we were able to turn that around pretty quickly. But again, I think it's the priorities that we are missing. We hear the same numbers all the time about increase in spending and all the mandates and things, but when I look around here and I see the missed opportunities that that the legislature did last year, how we're spending so much money on an office building that is not needed to that level, $730 million. We're going to spend $688 million on a government-run, paid family that could have been done so much less and copied by so many other states. We could have offered a really great plan privately. It would not have put the taxpayers at a huge risk down the road. But we set aside almost $700 million for that. And when I think of that, I think of how much that could have gone towards human services, our nursing homes, our mental health. We wouldn't have had to close Care St. Peter, which I think is still on the chopping block, which is scary to me. That shouldn't be happening. We have to find forensic beds in St. Peter, but not by closing other areas. We can do better. And again, I mentioned this last Friday. The workforce general spending last year was incredibly over the top. It should have never hit $500 million of workforce spending to create jobs in way too many nonprofits that just are not set up for this. That was probably the biggest area that we, as legislators or the people running the show last year, should have done a much better job there, because that was just terribly overspending. But there are some really good things in this bill. We did the best we could in committee to try to keep people on task and focused, and we asked a lot of questions. There's a lot of good things happening around the state with people that care. But members, the best thing that can happen is if government just knows when to get out of the way. Don't create more mandates because you think you're going to help. By creating more mandates, a lot of times, is closing things down. Making things harder for employers to hire people and do more paperwork is not helping at all. And we have enough rules out there and enough policies, regulations. We are licensed. We get annual visits, if not further, and more of them. But you're making it harder to carry out the work in mental services, in human services. So I hope that we can learn from what happened. And I think you guys are seeing a lot of regret in the way the money was spent last year. We are just trying to shake this tree as hard as we can to find the extra change that should have been there wholeheartedly. There should have been $10 billion left on the bottom line instead of raising taxes by $10 billion. We should have had that this year to work with what we missed last year. So again, thank you again, Chair Knorr, for not raiding the ORAC fund right now. That was a big deal to our folks. And I just want to put out a warning to future legislators on any side of the aisle, I don't care. That is money that is being focused on by people in the community, by members that were handpicked to go and know where it should go. We should not go in that direction. And I want to protect that no matter what, because you're just completely undermining all the work that Representative Olson and I did a few years back to give it the focus it really needs. Legislators, you don't do that. We don't need to do that again. So I appreciate your acknowledging that. I appreciate all the conversations today. Members, I look forward to a bill coming back that we can actually support at the end. So thank you so much for this, Madam Speaker. Thank you.
I recognize the member from Hennepin, Representative Bonner.
Thank you, Madam Chair and members. You know, this is a really incredible committee, and it's a hard committee. It's a hard committee because I think we all acknowledge that the need across our state for human services is incredibly immense. And no matter how much money we have in our coffers, there will never, ever be enough. Every day we have to make really hard decisions about what to fund and what not to fund. And the truth is, there are days when we all go home with our hearts heavy because we know that we are not able to fund every priority and every need. And there is no one that hits this committee that is less deserving than the other. There just isn't. That's the reality of what we face. But let's talk about a couple of the things we heard today. We spent a lot of time talking about the loan program. We spent a lot of time talking about how much money we spend on nursing homes. This is a non-budget year, friends. Every 2 years, we lay out our budget. And for that 2-year cycle, in this, we have it not only do we modify the program, but we increase the funding for the loan program to $7.7 million. Using a special revenue account for the loan program will be ongoing. $100 million in the loan program in 2023 under House File 3342. It provides $173 million in payments for individual nursing facilities throughout the state. Let me repeat that, because for the last several hours, I think some folks might be under the impression that we have not done anything to support our seniors and our facilities. So $173 million in payments, $75 million for nursing facilities, workforce incentive programs. We heard a lot about workforce tonight. $75 million. That's a lot. $36.5 million to increase reimbursement rates for these nursing facilities by $12.35 per resident day, starting July of 2023. That is a lot of money, my friends. You would think in this discussion that we haven't done right by our folks. Nothing could be further from the truth. We spent a lot of time, a lot of energy, and a lot of money to make sure that we take care of our nursing homes and our seniors. We talked about the contingency account today, and anyone who knows about this knows that having a contingency account is the fiscally responsible thing to do. It creates a contingency for unexpected expenses, for critical services. It is literally budgeting 101. It's good management practices. It's responsible, it's reasonable, and it's financially sound. Anyone who handles finances knows this. But what we haven't talked about a lot today, and very little, and we just started to kind of scratch the surface, is what are the things in a supplemental budget that we couldn't spend all of our time and money on last year in the 2-year budget that we do in this budget. So let's talk about that for a moment. We have, first of all, the pediatric hospital and in-home transition pilot from Representative Bierman, allowing us to discharge patients and bring kids home, to provide needed decompression for hospitals, and really to provide those services for kids and families. We have Representative Hicks and her disability services engagement. It's a study for persons experiencing and accessing and navigating the MA state plan, home and community-based services, to improve the experience for those accessing and navigating the system. If you've talked to anyone who accesses DHS services for this, they will tell you this is a real challenge. So putting people first and at the center of what we do. Representative Vernick has a bill around community disability workforce shortage pilot, and another around direct care and services core pilot. Again, we talked about that workforce. How do we make sure, through the Vernick and prior bills, that we're getting to the heart of where those individuals are and making sure that we can expand our workforce for tomorrow? At the rate that our population is going, we know more and more folks are retiring, and there is no possibility that we will not face workforce shortages. What we can do, however, is think ahead about how we fill those posts. In addition to that, we have some items around the preventing overdoses and the reentry waivers that can make a critical difference in reducing overdoses and deaths following release. That's an incredible priority. Then we have 2 bills by Edelson and Frederick to talk about peer recovery. These rein in abuses and set clear guardrails around peer recovery services that are much needed. We go into the Direct Care and Treatment Agency and making sure that that is set up appropriately and ready to serve the individuals within that program. We go on to supportive housing and work for the homelessness. Representative Keeler is a critical part of that equation, along with Representatives Fisher and some work from Representative Baker. It is to study supportive housing resources and streamline access, eligibility, and administration of state-funded supportive housing services. Those are pretty important priorities. Finally, we have some grants for rural and underserved communities. $2.7 million in FY25. That also increases support for minority providers and culturally specific outreach and education around home and community-based services. Pretty important stuff. Finally, we get to the last. Of course, I won't go into depth, but keeping open Care Carleton, a women's only run facility where patients have experienced physical and sexual abuse. They may be pregnant, have mental illness or substance use disorder. I'm pretty proud that we're able to keep that facility open. And I want to expound on that decision was made in unison and in collaboration with our friends on the other side of the aisle. I'm pretty proud of that. And finally, we address priority admissions and the 48-hour rule that we've heard so much about. It's a really critical part of this year's legislation. There are so many things in this bill. We've spent the last several hours talking about what's not in the bill, what we prioritized as part of our 2-year budget. But this isn't a 2-year budget. This is a supplemental budget. And I have to tell you, what I read you just now are the highlights. That does not even scratch the surface of all the things in this bill. What I want to say about this committee is that through the contributions of our Republican members, our Democratic members, we covered a lot of terrain in that supplemental budget. We were able to speak to our values and our priorities in a really incredible way. And we worked together to make that happen. That's a pretty incredible place to be in. I want to thank our staff for the incredible work that they do, because all of these programs are so incredibly complex. So I want to say thank you to our staff, most of whom have been hiding out in the alcoves for the last several hours in support of us and of this bill, who do the incredible work to make all of this possible. But I also want to say thank you to the members of our committee, both Republicans and Democrats. There's one thing that's clear about everyone who serves on the Human Services Committee. We all care deeply about people. And I think that transcends any disagreements we may have. And I am always in awe at the gifts and the talents of each of our members across all ideological frontiers that we are brought to bear in this committee. Because at the end of the day, human services is all about the people. It's about how we actually live up to our values and priorities and care for Minnesotans. So I just want to say thank you for all of the hard work from our committee members, for Chair Noor, who I know poured over spreadsheet after spreadsheet after spreadsheet to try and squeeze in every last drop we could fit in our supplemental budget. And no, we didn't cover everything. We get that. And we will never be able to cover everything. But this is a down payment on that. And I am proud to say that I intend to vote green on this bill.
I recognize the member from Chisago, Representative New Brindley.
Thank you, Madam Speaker.
First, I want to acknowledge something that Representative Bonner just said. It's actually my favorite part about the Human Services Committee. It happens to be a committee that doesn't get real heated. And it's because it really is a place where, first of all, I think everyone's asked to be there, has asked to be on that committee, and not everybody asks to be on human services or health committees. I get they're complicated, they're tough. They're hard committees because we really do hear heart-wrenching stories in these committees. And these are the committees where we see kind of where the rubber hits the road on what we do here. So thank you for that. Because I agree, Republican and Democrat, it does not matter. Every member of that committee cares deeply about people. In fact, I apply that and I say that to folks all the time, that if they only knew that really the vast majority of people in this chamber are good, decent people. We just disagree about how to solve the problems that are before us. And I'm sorry to say that we disagree in what's been laid forward in this bill. There's sort of there's some conflicting statements happening. But I guess I'll start by just addressing why I'm not going to support this bill tonight. And I've got sort of three overarching things that I'm going to talk about. Number one, this bill robs Peter to pay Paul, which is a problem. Number two, this bill puts our seniors at further risk. And number three, well, this is as Representative Bonner said, this is a non-budget year. And as Representative Norr said earlier, newsflash, there's no money left. We've already spent it. And yet this bill is filled with new program after new program after new program. It's death by 1,000 paper cuts. In a year that is supposed to be a supplemental budget, in a year that is supposed to cover those most essential things that need to be covered, this bill is filled with pilot programs, task forces, new programs. That's the kind of thing you do in a year that you have $30 billion to play with. That's not the kind of thing you do when we're passing a supplemental budget and heading into a deficit. But that's what this bill does. So let's break this down a little bit. And interestingly, this was the case last year with last year's Human Services bill. You know, when we stood to talk about that Human Services bill, we actually didn't have a problem with what was in the bill. We think your leadership failed you in not giving you enough money from the $30 billion we had to spend to actually cover the essential services that our state needs to deliver. But the individual projects were not problematic. And I would say the same thing about this bill, actually. The individual projects are not problematic. Where we get the funding is problematic. The fact that we are spending money we don't have is problematic. The fact that we are adding money to the tails is problematic. But for the most part, with a few notable exceptions, the actual provisions in the bill are not the problem. Again, with a few notable exceptions. These provisions, as you go through, initiate. That means start new mandates for our counties. Develop a new MA benefit. Study continuous improvement study, establishes a new pilot program, establishes a new grant program, establishes a reentry waiver, establishes a task force, establishes a DHS slush fund, establishes a new office for homelessness, develop a new waiver, study navigator reimbursement. These are the kinds of things you do when you have $30 billion to spend. These are not the kind of things you do when we are heading into a deficit. And while this committee had a target of just over $40 million, they're actually spending $60 million. This is almost a $60 million budget in a non-budget year. Let's talk about how this bill puts our seniors at risk. We've already discussed it ad nauseum, but I fear that we don't really get it yet. Because if we got it, we would fix it. Because it's really problematic. This bill eliminates the elderly waiver disproportionate share payments. This program was established to support our assisted living facilities. Now, interestingly, our assisted living facilities function differently than our nursing homes. Our assisted living facilities are allowed to charge a different payment for private payers versus Medicaid payers. Our nursing homes are not allowed to do that. They're not allowed to charge a private payer more, but our assisted living programs are allowed to do that. So what we did as a state is we said, okay, if we want our assisted living facilities to accept elderly waiver Medicaid residents into their facilities, then we're going to have to give them a little incentive to do so. Because the Medicaid payment doesn't actually cover their expenses. And so we came up with this disproportionate share program, this disproportionate share payment to say, okay, if you are willing to take 70% of your residents as Medicaid payers, then we'll give you this disproportionate share payment on top of that. Because otherwise, these folks are not going to have a place to go. These folks are not going to have a place to live. So by eliminating this disproportionate share, this is what's going to happen. These folks that are currently on MA, that are currently living in these assisted living facilities, are no longer going to have that option. They are going to have to find another home. Likely, they will be seeking another home in our nursing homes. It's the most expensive way to provide care, is through our nursing homes. But we are eliminating options for Medicaid patients currently living in assisted living facilities. Make no mistake, by eliminating disproportionate share, we will have fewer Medicaid patients living in assisted living facilities. There's just no question about that. There's no other option. There's no other option. Because even with the changes that were made to the elderly waiver for assisted living, it still doesn't make the cut. They're still being reimbursed based on 2017 numbers, but they're paying 2024 prices. Again, it's not magic, it's just math. It is just math. The elimination of disproportionate share is absolutely going to hurt our seniors. Now, at the same time we're doing that in this bill, we completely gut the loan program for financially distressed nursing homes. And again, there are currently 54 nursing homes. 54 nursing homes that are likely to qualify as distressed facilities. These are facilities that do not take in enough money each month to pay their bills every month. These are facilities that are right now today at risk of closure. But we're blowing up this loan program so that they will not get access to the dollars that they need. So this bill is a death by 1,000 paper cuts with new programs and new spending. It absolutely puts our seniors at risk, and it robs Peter to pay Paul. We haven't talked about this a whole lot, but by eliminating disproportionate share, we're booking a little over $10 million, $10.5 million in savings that we now get to spend. Woohoo! More money. We found more money. We found more money by taking it away from our seniors. And let's talk about where this more money is going. And again, I actually don't have a problem with the underlying programs. In fact, they're probably important. But we are robbing Peter to pay Paul. We are taking money from our seniors through disproportionate share. We are also taking money from our SUD programs by eliminating Care St. Peter. And we are transferring that money to the 1115 reentry waiver. It's going to cost $12 million. We are taking money from our seniors and we are putting it into a program to help our prisoners. That's what we're doing with that money. We are directly taking money from our seniors and we are putting it into a program to help our prisoners, to give a Medicaid benefit, a new Medicaid benefit to our prisoners. That's what we're doing. Now again, I'm not going to argue the virtue of the program, because hopefully, we don't know yet because it's a new program, we're establishing it. This is brand new. Hopefully it will do some good. But that good is being done at the expense of our seniors, period. That's what this bill does. It robs Peter to pay Paul. It robs our senior citizens to pay our prisoners. That's what this bill is doing. I'm not sure that's really the way we want to do this. I'm not sure that we've really thought this through entirely. I'll be voting no on this bill today. I don't think anybody is surprised by that revelation. But I'll go back to this. News flash, there's no money left. We've already spent it. The things that are being paid for in this bill should have been paid for when we had $30 billion. $30 billion. But instead, because we did not prioritize these things last year, when we actually had an ungodly amount of money to work with, because these were not priorities of the Democrats, now we are stealing money from our seniors and putting it in other programs. We're putting it in programs to support our prisoners by taking the money from our seniors. It's just not okay. It's shameful. I'll be voting no on the bill today.
To the author of the bill, the member from Hennepin, Representative Noor.
Thank you, Madam Speaker and members. I really enjoyed the robust discussion about the Human Services budget bill. Members, this is not about robbing Peter to pay Paul. It's making sure that Peter and Paul are getting paid. And so when we look through the process of the priority admissions, ensuring the children who are stuck in hospitals, the seniors and the individuals with mental health who are sitting in hospitals, that they're able to go to a setting that can provide the care for them. That those who need help to have their home ready for them, instead of going to a facility, which is going to cost us more money, that we can help them stay in their home. This bill ensures that we eliminate the parental fees. We took care of TEFRA. But now that the families that are burdened to pay that fee, we're paying for that. We're also making sure that parent and spouse can take care of their loved ones in their home. Because of the exclusion that exists right now under PCA, we're extending a little bit of help, knowing that there's a workforce shortage. If you've got a child who needs PCA, as a parent, you should be able to care for that child. As a spouse, you're supposed to be able to do that work, because if you can't find someone, there's no way you will go to work. Members, this is about being compassionate, understanding the needs of those who we are serving. As we're looking for other ways, we're trying to address the need of the acute care transition through the process of also the priority admissions. As we expand services for those who are civilly committed. Members, we've got people who are sitting in the hospital right now who have been there for more than 600 days just waiting to be placed in a civil commitment facility. If you vote against this bill, you want to keep them to stay in a hospital setting. That is not right. We want to make sure that we do the right thing. Members, we're establishing a strong DCT, direct care and treatment, by having a board and also creating an advisory board that will be able to help them transition as we separate DHS and DCT and DCYF. It's a commitment that we want to make sure those who are civilly committed are able to get the services that they need in a care setting that will provide them that care. We also made a commitment to the workers who are in Carlton, to the people who are receiving that service in Care Carlton, that we are never going to close that facility. Recommendation from both sides of the aisle was to make sure that we take care of that as a number one priority, and we did. This bill, Madam Speaker and members, thanks to Representative Keeler, who has been a champion for homelessness. We want to make sure that homelessness stays within DHS, and we're creating a homelessness office within the department and making it a priority, because there's so many of our friends and neighbors and families and community members in our state who are homeless. If we don't do anything, we end up going to have problems down the road. We're not giving money to those who are in prison just because we want them to have that Medicaid. It's a re-entry 1115 waiver. If you go to jail right now, you lose any coverage and you're unable to get Medicaid. By requesting 1115 Medicaid federal waiver, we're going to be able to provide support for those who are in jail right now. Someone who's got mental health issues, someone who's got substance use disorder are able to get the care they need before they're released 90 days. It's about caring, it's about providing services that reflect our values. This bill reflects our values. This bill addresses the needs of Minnesotans. I ask you to vote green. Thank you so much.
The clerk will take the roll. Members, please vote. The chief clerk will call the names of the members voting remotely.
Carroll.
Carroll, I.
Carroll, I. Cagle.
Cagle, I.
Cagle, I.
The clerk will close the roll. There being 70 yeas and 59 nays, the bill is passed as amended and is titled agreed to.